Hi, I want to do a quick video on clinical nutrition, just the basics of what clinical nutrition is. So I prepared a few slides for you. Let me bring those up right now. Okay. What is clinical nutrition? Treatment based on functional diagnosis through dietary modifications and or nutrient concentrations. So this is very different than your fad diets or your fad supplements taken randomly. Here's how we're going to eat for weight loss or for improved longevity or whatever. Sometimes based on the ideal, but it's not based on the individual. It's not based on what their unique needs are at a given time, based on a part of their physiology that's not working very well. And so clinical nutrition is about identifying that problem area based on a functional diagnosis and then developing a treatment strategy that can include diet and or concentrated food sources or our supplements, which might have whole food concentrates, but it would be a therapeutic value, maybe a value that they can't get if they were to try to consume it just through the actual foods. So we can break this down into pharmacology and nutrition, and both sides of this are actually very useful. However, I tend to lean more on the nutrition side. And the nutrition side mainly refers to the whole food concentrates, whereas pharmacology is going to refer to synthetic vitamins, often single elements that are in a higher amount. Okay, so here we're getting into the whole food concentrates. This is raw material. I want you to think of raw material nutrition, even if we're concentrating it or we're changing the diet. It's basically the ingredients that the body needs for repair and function of the organs, glands, and tissues. We want the body to do the work for us. We're trying to figure out where that stumbling block is inside the body. So we've got to know our physiology, and then we're treating it with the goal of the body doing the work for us once it has what it needs. Pharmacology is different. This is really all about drug interactions. It's the study of what something does to the body and how it forces the body to do that. For example, we could look at it as mandating versus on the whole food side or the raw material side, facilitating. When you're mandating something, you're forcing it. When you're facilitating, you're giving the elements, allowing the body to decide how it takes action on it. Good example is our single elements, your excitatory amino acids, your minerals that we're taking in high amounts, your vitamins that we're taking in high amounts. Ascorbic acid is a good example of this. It can be made in a laboratory and produced in a tablet as a single molecule. You can take it in high amounts, and it might even have a benefit to the body. I do use it in practice sometimes, but it's not really repairing anything. It's forcing something. So an example of that is going to be, let's say somebody has an infection, a transient flora infection of the gastrointestinal tract. So they've got some gut issues there. And maybe even they're sensitive to other things, or they happen to have vitamin C already at home. Not good whole food concentrate vitamin C, just the cheap junk that's synthetic, that's in a high amount, these 1,000 milligram tablets. And they're slightly constipated. Well, taking a higher limit to that vitamin C is going to do a number of things. It's going to be a laxative, it's water soluble, it's safe, and it's going to acidify the GI tract, and it is mildly antimicrobial. It might be all they need if there's not a long-term chronic presentation going on. Whereas on the whole food concentration side, it might not be those 1,000 milligram tablets. It's going to be something more like whole food concentrates. Maybe it's a lower amount overall inside of the supplement or with the food choice strategy, but the goal is different. We're trying to repair something. You take that vitamin C and it has a laxative effect. The body's being forced into it. There's no choice there. You're not really repairing how the body got there, but you're trying to get rid of at least the infection. That might be a reasonable strategy. With the whole food concentration, let's say that somebody has something like capillary fragility, where you need all the cofactors to that vitamin C. The single molecule aspect that's synthetic and made in a laboratory is really not going to do the healing work of all the cofactors and bundles that come along with a whole food concentrate or with the food source itself if it's grown in healthy soil. Subclinical scurvy is actually something that's showing up. People who are bruising easy, especially if that's combined with high blood pressure, that's a big risk factor, right? They're breaking vessels and they have more pressure in the vessel. If that happens in the head, that could be a transient ischemic attack, right? A TIA, where they start to have pre-stroke and eventually vascular dementia. These things are very serious, but we need to improve that strength of the capillary and of the vessels to hold in the blood. Well, that's something that we would need whole foods for. Okay, single vitamins and minerals on one side, and then on the other side, really we're looking at phytochemical bundles. We might not even know exactly which part of that bundle is doing the work. We know that the sum total has a powerful synergistic quality to it. Studies on the pharmacology side of nutrition are focused on biochemistry, and the research is used with single lever mechanisms studied. And what that means is that the body is not looked at as a complexity, which is actually how it is, but there's isolated small mechanisms that have one dynamic to them. That's the study. And then if we press the button and get the same reproducible result, then that's something that can be published. It's on paper. And then the doctors who are new to functional medicine, who don't really understand how to dig in and connect the physiology to the chief complaint, they're able to give a bunch of supplements based on a bunch of labs. This is not great, in my opinion. And sometimes there's some benefits that way, but it's a huge guessing game. It's full of costly labs and usually tons of supplements. Better is that we understand through physiology and pathophysiology, how did they get that symptom? And a lot of those elements of that case taking aren't going to show up on a lab. They're subclinical. You've got to know the function to know the breakdown in function and to know what could explain those symptoms. And then even what you give the patient is also diagnostic. If we understand that the liver's the likely player in a given case and we start treating that liver, the improvement of multiple symptoms, including the chief complaint, by treating the liver does tell us that we're on track with a diagnosis of the liver, even though their labs are unremarkable. Okay, this is sometimes called nutraceutical. Doesn't mean it's not valuable. There are some things to borrow, just like sometimes the best tool is a drug or a surgery. Not everything is functional. Now, on the whole food concentrate side, studies are more focused on plants, animals, even anthropology, what a particular population went through at a given time period, diseases and breakthroughs. And so some of that is subject to interpretation. And even we have historical applications taken into consideration. Huge bodies of herbal medicine are taught that way, where there is a lack of research because it wouldn't fit. You can't take the same herb for the same headache and press the button, get the reproducible amount, because in reality, each headache patient has a different cause. So it's challenging. And because of that, the higher liability licenses, like medical doctor, tend to not use this side of the stream. Whereas doctors like myself, who are research scientists who have a lower liability primary care license, acupuncture, chiropractor, we have a little bit more wiggle room. We can explore these options based on the efficacy that we're seeing from clinicians in the field ahead of us and even our own years of clinical experience and expertise. That becomes just as valid as a form of science. Here's what we're seeing, here's what's working, and it is indeed reproducible. And here's the pictures through the patient presentations that guide us. Here's the biomarkers that tell us where we're at. And it all goes back to signs, symptoms, a good medical history, a good intake, physical examination, looking at the complexion, the tongue, the pulse, All of those things matter. So to just run a bunch of lab tests and give a bunch of drugs, we know we're all tired of that. But it's not much better to run a bunch of tests and give a bunch of supplements based on tests without understanding anything deeper. Okay, so we might call this whole food nutrition or raw material nutrition. Both are considered clinical nutrition and both can be valuable when used to treat patients if they're based on something that we have relevant to the patient, their needs, and we have a diagnosis based on function with a treatment strategy. And we're monitoring where we're at within the case. Okay, last thing I want to mention is herbs. Herbs are both. They have a nutrient bundle in them that makes them valuable for long term repair. However, they're definitely drug like. For that reason, not a big fan of taking random retailed herbs. Everybody wants to take turmeric. And when you ask them why it is, they say it's anti inflammatory. But what does that mean? What if it, how are they, and how is it anti inflammatory? If the inflammation is caused by an infection, then it would have to be antimicrobial to get that anti-inflammatory effect. So what's going on with the patient? Is it an infection? Well, there's nothing below the surface. There's no deeper investigation. It's just take this herb. Furthermore, the retailers will carry herbs that really haven't been evaluated by any rigorous testing to know that the active ingredient is even in there or that there aren't contaminants. For that reason, everything that we get in our office is literally pharmaceutical grade. The last thing that we want is to be second guessing the herbs we're using. If we're not getting it, we know it's us, we're missing something, and as a team, we reevaluate, knowing that there's consistency in the products that we're using. I hope you enjoyed this, and there will be more to come. All right, take care.